And Betsy, as Governor DeWine pushes ahead with plans here in Ohio, the federal government is now freeing up its reserve of vaccines to get it to the states. So what does that mean for us here in Ohio? Senior health correspondent Monica Robbins joins us now. Monica, good afternoon to you. This sounds, Monica, like it's good news.
Oh, it's great news, Jay. Yeah, but if Ohio is only getting about 100,000 doses next week, that is still a far cry from what is needed. I mean, that's not even going to cover 80-year-olds in Cuyahoga County. Now, the health departments are ready to start those mass vaccination efforts. UH is planning one next week, and Cuyahoga and Summit counties are also finishing up those people in the 1A groups, those frontline responders. The problem, they're telling me, is that they're not being told how much to expect so they can plan accordingly.
This vaccine is a precious resource, and we want to get it into arms as quickly as we can, but we don't exactly know how much we're going to get until it arrives.
You're going to throw together all these resources, and you might only get 100 doses, which you probably could have done appointment-based that would have been a lot more cost-effective. And so without knowing the whole picture of what you're getting every week and what it's going to look like, it's very difficult to plan these large-scale operations.
So hopefully now that the states will be getting more vaccines, those answers will be coming, and at least we hope there will be some lead time for these facilities. But the big question is, how do you get one? Where do you sign up? Well, right now, the easiest thing you can do is go to your County Board of Health website. Many already have online sign up available, and you will be notified when it's your turn. Now, if you don't have a computer, you can access or ask someone to help you, or pick up the phone and give the health department a call. UH tells me their patients will be notified, but also keep checking their website, because they too will have sign up available for anybody, even if you're a patient or not. And expect pharmacies to come online in the coming weeks as well. And what's really important, though, is that you don't miss your appointment, because if you do, you go to the end of the line. And Jay, just earlier, about 10 minutes ago, I just got a notification that the National Association of Retail Pharmacies is going to make an announcement tomorrow. They're having a press conference about how they will be getting involved. So your CVS's and your Walgreens will also soon, hopefully, be giving out those vaccines.
Well, that's great news. I know it'll make it a lot more convenient for many to get those vaccines. A big question here, Monica, is the second dose. We know that there are 2 shots that go along with this, and we've heard there's a time frame, about 3 weeks between shots. What happens if there's a backlog and they don't have that shot ready to go at that 3-week period? Do the people that got vaccinated with the first shot run a risk of not getting that second shot at 3 weeks?
Well, that's what we're hoping doesn't happen. And right now, Pfizer and Moderna say they do have the supply, and that shouldn't happen. Now, the UK is actually doing that in some cases where they're only giving people 1 shot. However, the FDA is advising against it because there is not enough research. Now, we do know that Pfizer's was tested up to 12 weeks apart, but health officials say it's just best to follow the guidelines right now. And though the manufacturers, again, they're saying they will have enough supply for everybody, it's just going to be a wait and see. But when you do make your appointment to get your first dose, they are scheduling those second doses at the same time.
Well, hopefully the vaccines can keep up with the appointments. Monica, great information. Thank you. We appreciate it.